All right, welcome back, folks. Continuing work this morning. We have friends here from the Vermont Veterans Home. I do have to remove myself from this conversation for another meeting, so I'm going to hand off to Vice Chair Hango for this one. Representative Hango, the helm is yours.
Good morning and welcome. Our first witness is Melissa Jackson. You are muted, Melissa. No. Any suggestions, Autumn?
How about now?
Yes, that's perfect. Thank you.
Good morning, Melissa Jackson, CEO of the Vermont Veterans Home. Apologize for the technical difficulties.
It's okay. Thank you for joining us.
Appreciate the opportunity. I sent over our 2026 budget brief. I don't intend to go through all of the slides, but a lot of the first part of the slides gives you a good overview of who we are and what we do. So I will get started unless there's some initial questions you would like me to answer.
No, thank you. Go ahead.
Okay. So I always like to remind everyone that we are an agency of the state of Vermont. We have state employees. I think now more than ever, it's really important to know that we are not part of the VA and we are not terminating employees as the federal government is. So our mission all starts with a promise. It's actually part of Abraham Lincoln's second inaugural address, to care for he who has borne the battle, his widow and orphan. We are our only state veterans home. Most states across the country have numerous state veterans homes, but we're our only one here in Vermont. We were incorporated in 1884, and our first inmate, as they were called back then, was admitted on May 1st, 1887. Excuse me, May 18th. And we were a self-contained working farm for Civil War veterans. I report directly to a board of trustees, and I see that a few members of your committee are also members of the board of trustees. So what makes a state veterans home different than any other nursing home that you would see across the country? It is a home that is owned and operated and managed by the state. We enter into a provider agreement with the Veterans Administration to care strictly for veterans, their spouses, and Gold Star parents. For that provider agreement, we receive additional VA funding that other nursing homes do not receive. And that funding comes in two types. The first is a basic per diem that we receive for all veterans, which right now is $144.10 for our veterans in our nursing home, and $62.20 for our residents in our DOM. The domiciliary, which I can never say, equates to a residential care level 3 in AHS Vermont language. So the remainder of the cost for individuals who receive the basic per diem is covered either under Medicare, Medicaid, private pay, or long-term care insurance. And for the individuals in the DOM, it is private pay funds. So annually, we receive about $7.6 million in funding from the VA. And this year, we're requesting about $10 million in general funds to help supplement our budget. On slide 8, this is really what distinguishes us from other nursing homes. VA pays what's called for full cost of care reimbursements. Veterans who are deemed by the Veterans Administration to be 70% or more service-connected disabled, they will pay us $555.55 to care for those veterans in our nursing home. So of course, when you come to our facility, you'll see a lot of individuals using walkers or canes or wheelchairs. So it's easy for one to assume that everybody has a service-connected disability, and that's not necessarily the case. About 25% of our population has an injury or an illness that directly relates back to their service. So for those individuals, this $555 covers their room and board, medications, medical supplies, physician visits, physical therapy, occupational therapy, speech therapy. And because we are getting paid by the VA for those full, at that full cost of care, we cannot bill any other insurance they may have. If they have Medicare or Blue Cross, we cannot bill for those. So. Slide 9 breaks down our VA income. So the stipend for the nursing home is $2.6 million a year. The DOM stipend is $136,000 a year, and we receive $4.8 million in the full cost of care funding. So as I mentioned before, we take care of veterans, their spouses, and Gold Star parents. We're 130 licensed nursing home beds, but we do have 30 of our nursing home beds offline for 2 reasons. One, we have a wing of the building that is in desperate need of renovation, and we are in the process of applying for a VA grant to help cover some of that cost. Another benefit of being a state veterans home is the VA will pick up 65% of the cost of major renovations, and the state pays 35%. So the renovation of this wing, which needs to be totally torn down and rebuilt, is going to be approximately $32 million. So we are attempting to help save the state some money. So those beds are offline due to that, as well as the healthcare staffing shortage has impacted us dramatically. Annually, we are spending almost $8 million on agency or traveling nurses, whichever term you use, due to our inability to recruit and hire staff. The services we provide are long-term care, short-term care. Short-term care, had a knee replacement, hip replacement, some cardiac issues. You come and stay with us for a while, we get you back on your feet, and we send you home. We do respite care. This is where individuals are at home with their loved one and they're their primary caregiver. And the primary caregiver needs a break, wants to go on vacation, or may have some health needs of their own that need to be taken care of. The veteran comes and stays with us. We have a few veterans who come periodically, almost like clockwork throughout the years, and then eventually they come and stay with us permanently. And sometimes there is no plan for them to go home, or there's no plan for us to stay with us, but then they don't want to go home because they like us so much. We do hospice and palliative care, outpatient rehab, and we are known internationally for our Namaste program, which Namaste means honoring the spirit within. This is a program that started here at the Vermont Veterans Home and has gone international. This past spring, or last fall, excuse me, 2 of our staff members were invited to London, England to present at the International Namaste Conference about how this program started here and where we are today. So we're very proud of that program. We have 3 guest rooms now for family members, being down here in the little corner of Vermont. Sometimes I feel like we're part of New York, but we know we're part of Vermont. We have guest rooms for family members. They can come and stay with us free of charge. They're basic, just rooms with bathrooms, but it allows them to come and stay, especially if we have family members from the northern parts of the state. If unfortunately your loved one is passing away, it gives them the ability to be right in the facility 24/7 with their loved ones. Slide 11 is Pinnacle Performances. Pinnacle is an organization that we contract with. Every month, they take 1/12 of our population and they reach out to either the veteran, if they are able to participate, or their family member and ask how we're doing. So the red line is the national average. The blue line is what they call best in class, and the purple line is where the Vermont veterans home is. And we are consistently exceeding the best in class in all the years I've been here. So we're very proud of the work that we do. Additionally, this year, we were one of 2 facilities in the entire state of Vermont to be recognized by U.S. News and World Report as best nursing homes for long-term and short-term care. And I have 2 employees who are on their way back from Atlanta, Georgia, where they accepted the National Bronze Quality Award that we received for our overall quality in our nursing. The next slide is just some general comments about from our families and our residents. As you can see, we have a 99% favorability rating, and that is, would they recommend us to others to come and have people stay here? I'll take a breath. Does anyone have any questions thus far?
Any questions? I just have one question, and that goes way back to the beginning. The $7.6 million that is received from the VA, is that in danger of being cut because that is a federal agency?
So right now it is not.
Okay.
But as we know, every moment's a new moment in Washington, D.C.
Mhm.
I am very active in what's called the National Association of State Veterans Homes. I'm a past president. I am currently the liaison officer between the organization and the VA. I spend a lot of time on the phone and emails. And thus far, we have been told our funding is solid. I've also been keeping in close contact with our federal congressional delegation. So if something changes, I'll make sure everyone knows as soon as I know. But
Thank you for that.
yes.
Any other questions for Melissa at this moment? Okay, go ahead.
Right. The next slide gives you our general fund request history. And I want to address the big jump between FY25 and FY26. So for many years, we've come back and asked for a budget adjustment because we are very fortunate in that the Agency of Human Services applied for what's called an 1155 waiver for us. As the only state nursing home, we are able to get our full cost of care. So what has been happening is we receive an interim rate of $445, to look at everybody, per day per veteran on Medicaid. And then annually, after we submit our cost report, we get what's called true up to our actual cost. And then we receive Medicaid settlement dollars. And we would come back through budget adjustment, account for those dollars, as well as expenses that weren't put into our budget. This year, instead of pushing the funding back and forth, we put in an all-in budget, thus increasing our what looks like a general fund ask. But if you go back and look at what our initial general fund ask has been, as well as budget adjustment, you will see that it's been roughly in that 30% tile request. But this graph looks a little skewed based on that. And then the next slide just basically repeats that information. The next slide up, which is page notation 17, I think is really important, especially as we worry about what's going on in the federal government, as well now as we're watching what's happening with tariffs day to day. Last night, I saw that there's the potential of 10% tariffs now in pharmaceuticals, as well as looking at over 70% of our products that we use come from China. There's a lot of pressure on our budget, and almost 64% of our budget is fixed costs, leaving very little wiggle room. I'm very proud of my staff. They do a great job managing the funds that we are able to control, but we have very little ability to pinch pennies, so to speak. So the next slide breaks down what those fixed costs are, which are salaries, our benefits, Medicaid tax, our state allocations. The things we have some control over is our food, other operating expenses. When it comes to repairs, what things are urgent and need to be done now, and what can we push off. But we do have an aging building, so sometimes that's difficult. Those are hard decisions to make. Slide 19 talks about how we collect 68 cents of every dollar. And our budget is made up of 36.7% Medicaid dollars, 4.3% private pay, almost 2% Medicare, 15% VA, and then the daily stipend is 9%, and then our DUM is less than 1%.
Melissa, could I interrupt you for just a second to go back to the slide with the budget
Yes.
fixed and non-fixed costs? The total loss from operations is the exact dollar amount of the general fund.
Correct.
Is that to balance your budget? The
Yes.
state budget steps in, budget process steps in to balance your budget.
That is correct. Yes.
And do you have to ask for that, a specific amount every year in terms of balancing your budget rather than the same ask every year? You tailor it to that year's operating costs?
Yes.
Okay,
We tailor it
thank
to-
you.
Yep.
Thank you. And are you statutorily required to balance your budget?
I believe we are. I haven't seen it in statute, but I believe we are.
Okay, thank you. I see your CFO, I think it is nodding
Yeah.
his, thank you so much.
That's
Go ahead.
The next slide, slide 20, just gives you a kind of a trend line of increases over the past few years. What we are seeing recently through COVID and even into this year is the need to increase salaries to be competitive. Our dietary staff just received a significant increase that is going to be impacting our budget to the tune of $250,000. That was to bring them up to be competitive with Burger King, that's starting them out at $17 an hour, where we were only paying $13 an hour. So this is a vicious cycle where all the employers raise their rates, and it just keeps going and going. And even with the raises that our nurses have received recently, dietary, housekeeping, we're still one of the lower payer employers in the area. Great place to work, but it's hard to compete, especially with our local hospital. New grad nurses can go there. They can work for the hospital for a few years and they'll pay off all of their tuition. So the next slide is just a brief overview of the Board of Trustees strategic plan. We spent a lot of time a few years ago developing a strategic plan. These review the top categories. There was some legislative change last year that would allow us, if we would like to expand our services beyond our Bennington footprint based on the current economic situation we're in, as well as the staffing piece for healthcare. There is no plans to expand our services at this time. Although we are entering into a really great collaboration, I personally feel. We are working with the Bennington Conservation District, and they are going to be starting a veteran incubator farm. So this is a farm program where they're going to be leasing the land from the Board of Trustees, and they'll be starting a farming program for veterans who've been just getting out of the military. They will learn to farm, and then they will be moving out into Vermont and continuing the farming tradition. It'll be bringing hopefully new, younger people into Vermont, helping the Vermont economy. Our facility will benefit. We'll be purchasing some of the food from the co-op. Our veterans will be able to participate. And then there's the whole mental health piece. There has been a lot of research around how farming helps veterans with PTSD. This is a very big movement out west, where farming has helped individuals with PTSD come off their medications. So we're really, really excited about this. We had a meeting with the farmers the other day. First up, their chicken should be arriving in a few months, and we'll be doing some composting. There's plans for berry bushes and high tunnels. It's going to be a perpetual project. They'll be working with the high school that's out back, Bennington College. So it's a big community effort. So we're really glad to be a part of it and to continue our mission to help veterans, not those who need long-term care. So more to come on that. All right. So who lives here? So our average age is 81. Our youngest veteran is 55 and our oldest veteran is 100. I just had coffee with him this morning. Steve, he was looking for you, so you need to say hi later. We have 81 males, 14 females, 82 veterans, including 2 women. We still have a few World War II vets, and they are very with it and keep me on my toes.
Can I just mention something about that? The coffee guy, the 100-year-old, he is our D-Day vet here at the Vermont Veterans Home, and a former police chief. So a heck of a nice guy.
Thank you for telling us about him.
Yep. So obviously, Vietnam War veterans are our highest population of vets right now. A few Gulf War and Cold War. We are waiting to see what the impact of the PACT Act will be in terms of what type of new veterans we will be receiving. Obviously, we continue to see individuals with PTSD, mental health, and substance abuse, especially the difficult behaviors associated with mental health on top of dementia. That's where we have our biggest challenges with behaviors with our veterans. But our staff has done a phenomenal job in attempting to manage those. For many years, I would sit and testify that we had one veteran who was on one-on-one for 24 hours, 7 days a week. And I'm happy to report that we're now just using one-on-one at brief moments with all of our veterans based on great treatment plans and interventions. So we no longer have to have someone with any of our veterans 24 hours, 7 days a week. So here are some more key factors of our budget request. Almost 58% is our salaries and benefits, our state allotments. And then our challenges, as I mentioned earlier, having the 30 beds offline, the cost of agency staff, as I said, $7 to $8 million. We continue to struggle with the cost that veteran care or parts of the care should be free. And that's because what veterans receive in the community by what they receive here can be significantly different. Yesterday, Steve took a phone call from a family member who was very, very upset. Veterans in the community get their medications for free. When you come to the vet's home, that is not the case. And if you don't have Medicare Part D, you end up paying for your medications. So the family member, although this was explained at the time of admission, was very upset that they received a very costly bill. And then slide 26 just gives you a rough idea of the difference between what we pay our staff and what we pay agency or traveling staff to work with us. And it is significant. The good news is we've had 2 very successful LNA classes. We ended up having 12 graduates. All of them came to work for us. We are in the process of doing interviews for another class that will start in June. And our plan is to continue to offer these LNA classes. Our biggest challenge for hiring is RNs and LPNs for second shift. And we've developed our budget on an average daily census of 90. Today we are at 87. And our DOM has can be at 8, and we have a census of 7. So, any questions?
Any questions from the committee? I do want to acknowledge that we have a couple of members of the Board of Trustees here, Representative Hooper, Representative Morrissey, and Representative Pincinel. Are you also a trustee?
Yes.
Yes, I thought you're not a trustee. You are their home representative, district representative. Sorry, I thought you were a trustee.
She's here as an honorary trustee.
Yes, I would think so after this many years. Thank you for being here, though, to listen to the testimony, and thank you both for being on the board, because it's really important to have people who understand the legislative process being on the board of something as unique as this.
Always here to support all that.
Thank you. Thank
And I
you,
know,
Representative Morrissey.
and I know you guys are very busy, but I really encourage you to come down nights, weekends, whenever. What I can't put in a presentation is the beauty of our 84 acres, our airsoft rifle and pistol range, our trout pond, the golf cart that just went whizzing by with all the vets on it, our deer park, the high school kids during cross country, you know, just the life that is here at this home is phenomenal. So anytime, call or email, I will gladly meet you here and show you what a phenomenal place this is.
Thank you for that offer. This committee, even when it was in a different committee, the jurisdiction has talked about a field trip, and our planned field trip got canceled due to COVID. So that was 5 years ago that we actually had one planned, and we've talked about doing another one. So stay tuned. Maybe we'll be able to do that. I see
Anytime.
Rep. Hooper, Rep. Morgan nodding your head. Everybody's nodding your head. Field trip. Because Bennington is a beautiful town, and I've heard your campus is lovely.
Yes, it is quite nice.
Actually, House Institutions is planning a trip. You should come along.
Oh, good to know.
Oh, okay.
Okay, so I will reach out to them and see what we can do for that. Thank you for bringing that up. That's the committee you sit on, right?
Well, yes, that's.
Okay. Thank you for letting us know.
We should call dibs on the rooms.
You think so for the future?
No. Those are available.
Okay. Any questions for Melissa and her counterpart? Thank you very much. I think it's been a little while since this committee had an introduction to the Vermont Veterans Home, and we're happy to hear your information updated and sounding, I think, a little more positive than last time you presented to us, when you were using a lot of traveling nurses and had some more concerns.
I appreciate your time. I know you guys are very busy, so thank you for allowing us to share our news.
Thank you.
Thank you.
Give Wally my best.
Yes, I will, as soon as I'm done.
Thank you very much. Have a good day.
Bye-bye. Thank you.